Hi, I'm Andrea Leonard. I am a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. And I just wanted to take a brief couple moments to talk to you about exercise programming for prostate cancer patients and survivors. As a cancer exercise specialist, it will be critical to do an initial assessment, get them to fill out their health history questionnaire comprehensively. And during that postural assessment, we will look for muscle imbalances that may have arisen from surgery or treatment, or maybe it's just lifestyle previously. However, it will be important to understand whether they've had a retropubic or perineal prostatectomy. If it's retropubic, they will have the incision in the abdominal area and it'll be a vertical incision. So what you're going to be looking for is to see if they are flexed forward. And if they are, we must stretch out the abdomen and strengthen the opposing lower back muscles and core stabilizers prior to having them do any type of crunch type exercise. Otherwise, we will only exacerbate this condition. However, you can get them working on an exercise ball, on balance discs, a foam roller, anything that will work their core without doing that forward hip flexion. Now, if they've had perineal prostatectomy, then you want to be very careful when introducing any type of squatting or lunging. And you'll wait at least 12 weeks after surgery and then start with just body weight exercises regardless of what they were doing prior to their surgery. Just start with a few repetitions and make sure their form is good, and then you can gradually add more repetitions and very slowly begin to add weight or resistance. Because the other component of this is whether or not they've had lymph nodes removed or irradiated. And if so, they will be at risk for lower extremity lymphedema. So you'll want to start every session with at least a 5-minute low-intensity cardio warm-up, getting their body ready for exercise, and then have them supine on the floor to go through a series of lymphatic drainage exercises that essentially allow the legs, where the pooling of lymphatic fluid could take place, to drain into the torso. So it's a very specific protocol that we use. The other thing is they may have a laparoscopic surgery, which would be a few small incisions, and the recovery is much quicker, less pain, less blood loss than what we call an open surgery, which is your traditional incision. And then, of course, if your client is going through any hormonal therapy, there is a very good likelihood that they will gain weight. So body composition is going to be critical, and having them work with a registered dietitian or nutritionist that can help them to lose body fat. And then we, of course, can work on increasing lean muscle mass at the same time. But while they'll have no limitations for weight-bearing exercise on their upper body, again, they have to go very slowly with their lower body because we don't know what their lymphatic system can now handle. Also, men will have a tendency to lose lean muscle and have breast tenderness and growth or gynecomastia. So this can have a very psychological impact as well, and a support group or a counselor therapist can also be very helpful. I can't emphasize enough how important proper education and training is with working with any cancer patient, and I'm only giving you a little snippet of everything that's involved. So I am so excited that CETI, Cancer Exercise Training Institute, is now offering live workshops as well as online training in Asia. And I hope you will take advantage of the best training that is offered anywhere in the world. Visit us at ceti.teachable.com.